Good morning, good afternoon, good evening. Welcome to the webinar linking social protection and humanitarian cash and voucher assistance. What do we really know and where to start? As we do every single webinar that we have as part of this Grand Bargain subgroup, cash subgroup series, is we are going to run a quick poll, and the poll is just asking, who's joining us? And if you could please select one of the following. Are you a social protection actor? Are you a humanitarian actor? Are you both? Or are you neither? The reason we run this poll is to be able to give us an idea and to give our wonderful panelists an idea so that we can figure out who is who, so that they can take a look at tailoring their comments appropriately. My connection is telling me it is slow, but hopefully you can hear me and that it's going okay. I'm going to give us another, I don't know, couple of seconds to be able to fill out that poll. It's great. We're getting a bunch of responses coming through. And to close the poll in 5, 4, 3, 2, 1. And I'm hoping the results can be shared. There we go. And it's great. 50% of our audience is humanitarian. We have quite a few social protection actors, and this is probably the highest number of people who identify as both, 27%. I don't think in the launch that in the webinars that we've had so far that we've had that many people. So that is fantastic. Moving right along, and I don't know if you can see my, I'll do my camera really quickly. If we can go to the next slide, please. I just wanted to very quickly, and they will be introduced properly later on, but we do have our speakers, Paul Harvey. If you can just wave, Paul, that would be great. We've got Daniel Longhurst as well. We have Dr. Rachel Slater joining us also, and this webinar is actually going to be moderated by Julie Lawson McDowell. If we can go to the next slide, please. By the way, I'm Zara Rizvi. I should have probably said that at the beginning. I work with the Grand Bargain Cash subgroup, which is looking at linking social protection with humanitarian cash transfers. This webinar is part of the knowledge management and learning work. The Grand Bargain Cash subgroup is co-led by IFRC, UNICEF, and DFID, and the group includes both social protection and humanitarian actors. It had come out of the World Humanitarian Summit in 2016, where it was clear that we needed to be linking social protection and humanitarian work better. And I think we can all agree it is even more clear today that we need to be looking at linking this work. The knowledge management work is managed by UNICEF, funded by DFID, and the purpose is to bridge the two worlds of social protection actors and humanitarian actors, and we do this with different products. And the products are geared to practitioners in the space. This includes this webinar series, discussion threads that we have on CALP and the online community for social protection in crisis contexts, a newsletter that we've launched since COVID, since this pandemic. We also have a light touch mapping where we're seeing, and we're doing this mapping around where actors are working together in cash, and all of those links and materials will be put in the chat box for you over there by our wonderful colleagues at socialprotection.org. We're incredibly pleased to be co-hosting this webinar with CALP, with the CALP network. And with that, I think I can go ahead and introduce you to Julie Lawson McDowell. Actually, before I do that, I do want to make a plug for the survey that comes up after you leave this webinar, and if you can please fill that out. It's from socialprotection.org. The reason is because we actually use those results. So send us all your comments, tell us how this is going, etc. So it just makes us, it helps us improve, and we absolutely read every single one of those, every single one of the feedbacks that's coming in. So with that, I'm going to introduce Julie, and Julie has worked with NGOs, INGOs, bilaterals and multilaterals, as well as research institutes in humanitarian responses in Kenya and Somalia, and social protection responses in Zambia and East and Southern Africa regions. She is currently the Knowledge Management and Research Coordinator with the CALP network and leads their work on linkages between social protection and humanitarian cash transfers. If we can go to the next slide, and with that, for once, I can actually enjoy the webinar as an attendee. And Julie, I hand over to you.
Hi, hello everybody. I'd like to say a very warm welcome to our audience, whichever part of the world you're in. Thank you for joining us today. And thank you, Zara, for introducing us. I'd also like to thank the co-leads of the Grand Bargain subgroup on linking social protection and humanitarian cash for giving us this spot in their webinar series to present our findings. And I'd like to thank socialprotection.org for hosting us. So by way of introducing our panel, which is made up of 3 of the 4 authors of this report, I want to briefly explain how this work came about. As you may know, the Cash Learning Partnership, CALP, enables collaboration between organizations to increase the scale, but also the quality of humanitarian cash and voucher assistance, while also supporting these organizations to make their own progress. And we do this by bringing organizations together to strengthen capacity, increase knowledge, coordination, and policy for cash and voucher assistance. So several months ago, we were thinking, right, we need to revise our capacity building work on linking social protection and humanitarian cash and voucher assistance. There's been so much going on. There's been lots of new thinking, lots of new developments in different parts of the world and in different countries. And we needed to understand better what were the current needs and the audience, and what our role should be in trying to support people in working in this area. But we realized that if we were going to do this, and if we were going to properly understand and meet the needs of different stakeholders, we had to have some sort of update on the latest developments in this critical but very complex area, and that we needed to hear from both sides of the debate, from the humanitarian and also from the social protection, as well as those sort of trying to bring them together. And thanks to very generous funding from the German Federal Foreign Office, we were able to engage the team that you see before you today. And I should mention that one of the members is in the audience and will chip in at various points. So we have Rachel Slater, who is, I would say, a social protection specialist par excellence. And she works very much at the intersection between research, evidence, and policy. And I see her as one of the leading thinkers on when and how we should try and make social protection more flexible. Paul Harvey is a humanitarian with over 20 years as an aid worker, researcher, and consultant. Paul was a very early leader in thinking about how to use cash in humanitarian contexts, and he remains a strong advocate, but also a critic. Daniel Longhurst is an independent consultant who brings to thinking about social protection and humanitarian response a background of climate change adaptation and disaster risk management. And Rachel Sabatas-Wheeler, who's not on the panel, but who's with us, has focused her work and practice as a development economist over the last 20 years on analysing risk, vulnerability and poverty. And I'm sure you all know that she's been an important influence in most of the social protection frameworks we use today. So this is what we wanted, a team with considerable range and depth of experience from different directions that would challenge the practice and thinking, give us a state of the art, but also challenge each other so that we didn't get a sort of a simple story. So we understood where the nuances and where the difficulties were. However, as you all know, and as you see from my background, these are unusual days. So while COVID-19 wasn't the focus of this report. It would have been a missed opportunity at this really astonishing moment of large-scale social protection response to such a massive shock, not to try and learn from what our team has learned, and to try and draw ideas and approaches from this review to help us understand how best to respond to the COVID-19 crisis. I think all the team are probably engaged in some way or another in thinking about the response, and we're lucky that Daniel is part of DFID and GIZ's Space COVID-19 Hub, which is providing technical advice to over 20 countries in facing the pandemic. So the full report from this work will be available early next week on the KELP site. We've already published a blog, and I think there'll be a link to the blog to introduce it. And in a few weeks, we're going to follow up with a podcast to dive again into the issues that arise and perhaps respond to questions that come out of this webinar that we don't have time to discuss fully here. So I'm going to turn to the panelists, and I'm going to invite Paul to set the scene for us.
Thank you, Julie. Next slide, please. So it's great to be part of this discussion. It's been fantastic working with Rachel, and Daniel, although the fact that Rachel S and Rachel S are both Rachel S has been confusing. So I'm going to just briefly set the scene. I'm going to hand over to Rachel, who's going to present the sort of main body of the report, and then Daniel's going to reflect on some of the implications in relation to the current COVID-19 responses. I guess as a starting point, we've reflected in the report on if everyone wants to link, and there's no shortage, as Julie was just saying, of guidance, tools, conferences, webinars, discussions, particularly over the last 2 years. So if everyone wants to link and agrees it's a good idea, why has it been so slow? Why have we had to cite the same examples for so many years? And why does it remain so hard? And that's what we'll be talking about today, both sort of what's making it difficult, and what does that mean for how we think about training and capacity building and the ways in which we could do it better. Our overarching messages are about getting beyond the basics of 101, or of sort of the sort of basics of linking social protection and humanitarian cash, in terms of who's involved, where we attempt to link, and how we try and do it. Next slide. So in terms of the process, KELP tasked us to look at the state of the art in terms of the debate and what that means for approaches to training and capacity building. We were doing this, it's important to say, before the COVID-19 outbreak. So although we'll talk about what it means in relation to COVID and reflect on that, that wasn't the main focus of the research. We reviewed the literature, we talked to key people, and we did our best to navigate around a bunch of overlapping initiatives and not get people too fed up by talking to them about the same thing as someone else had been talking to them the previous week. And we were trying to figure out how in this report and today in this webinar we can say something useful and add value to the existing sort of guidance tools and discussions that already exist. And in doing that, the team we are is quite important. We're a group of people from both sort of social protection and humanitarian backgrounds. And so we didn't always agree, and we'll argue today, and we think in the report that that's healthy. That too often part of the problem of attempts to link is that it's been assumed that it's unproblematic and that it's possible to just have a sort of woolly agreement and consensus around what's desirable. And in fact, there are some real dilemmas, and what we should be aiming for is constructive argument. And so on that note, no, not on that note, next slide. Sorry. Just a reflection on sort of where we are before I hand over to Rachel. So I started working on when it makes sense to give people cash rather than stuff in humanitarian responses back in 2004. And I think it's worth just remembering before we start quite how much change there's been since then. Now, that's only 16 years. And when I started, it was quite an easy task to research because there were about half a dozen people doing something, 3 or 4 projects, and I could sort of feel like I had a overview of them fairly straightforwardly. And there wasn't that much social assistance either, beyond a few examples in the global south. And so in a relatively short period of time, big organizations have made huge changes in how they operate. Donors have changed their rules in how they fund. There's a lot more social assistance. There's a lot more humanitarian cash. And so there's a lot more to link between. And I think in sort of critiquing where we need to go and thinking how we can do it better, it's important to remember how far we've come. And as I said, I think in terms of looking now where we are, a lot of the guidance assumes that linkages are both an unequivocally good thing and relatively easy to achieve. And I think that's what we're arguing is problematic in this paper, and that it's problematic in practice. In practice, it's been hard. There've been long battles within organizations, with donors and with governments, and whatever current terminology is being used, the nexus, resilience, linking relief and development, the fact that we're still talking about it 20 and 30 years after people still started arguing for it shows that it's hard. So we argue in our paper need to be more explicit about the dilemmas and challenges to interrogate some of the assumptions that linking is always a good idea. And on that note, I will hand over to Rachel to talk about more of the detail in the paper.
So next slide, please. So we know that the conditions for creating those linkages between CDA and social protection have become more conducive. We've got more evidence under our belt, but not everything is positive. And Paul's done the good news story, and I guess it's over to me to start raising some of the challenges. We think that a core problem with the long debate is that we tend to always assume that stronger linkages are both right and that they're achievable, assuming that we have the right conceptual and technical solutions and we create those. But if that's the case, then our literature is kind of failing us. It largely fails to explain why we've failed to make this happen more in practice, and it tends to avoid unpicking those fundamental differences between the principles and approaches and ways of working that we have across humanitarian and social protection actors. And for us, we also think that at the heart of some of the differences we face are very different ways of looking at the role of the state. So social protection, having a really strong focus on supporting states to provide social assistance, and humanitarian action depending on often some critical distance from states in order to preserve humanitarian principles and to act as a provider of support as a last resort. And from those arise a set of really important and divergent issues around coordination and funding streams, technical tools, partnership arrangements, and so on. And so what we end up with is a conversation that's very instrumental and technical and doesn't really help us overcome the challenges we face going forward. So next slide, please. So I guess what I'm going to do today is try and pick up on those three arguments that Paul has raised. And the first one is really about what we call the linkages 101 paradox. Now, if calling this 101 seems like a strange thing or something that you don't understand at the moment, have a look at the table on the right-hand side. If we imagine we're registering for an undergraduate degree in linkages, we'd take a set of courses in our first year, Economics 101, Disasters 101, and so on. And within that, we'd have a Linkages 101 course. And that would provide us with the basics on how we deliver linkages between humanitarian cash and voucher assistance on the one hand and social protection on the other. And the paradox for us, which has been pointed out by many of the people that we interviewed during the course of this work, is that we have both at the same time this abundance of evidence, of literature, of guidance, but serious gaps in our knowledge and our capacity. So how in this abundance do we still have such huge knowledge gaps? And we think that it's because the basics are not yet comprehensively known. They're not applied widely, they're not mainstreamed into our programming, and they're not embedded securely in our systems, our procedures, and operational tools. So for us, overcoming that paradox is one of the first things that we need to do. Next slide, please. So how might we make Linkages 101 better? The overall argument that we make in the paper is that whilst linking cash and voucher assistance in humanitarian contexts with social protection holds all sorts of promise, there's a need for caution in assuming it's always the right thing to do. There's a need for more nuance in our decision making and a need to think more across all the different dimensions that involves. Now, we've tried to capture some of those dimensions in this graphic equalizer that we have here. So if you can imagine touching the blue button and trying to move from left to right across each of the dimensions. And what we think is that at the moment, we tend to be predominantly on the left-hand side of the continuum, and we don't really think about the broader range of situations in which we might be trying to achieve those linkages. And I want to reference the fact that we've drawn very heavily on the unbundled approach by Karen Seifert and colleagues, and those are shared as one of the materials resources for the webinar. So if we can start to move beyond and broaden these dimensions, how might we then step on even further to a Linkages 201, our second year of our undergraduate programme, or indeed a Linkages 301? So next slide, please. There's three main messages about how we get beyond that we want to present here. The first one is for us to think about operational and strategic partnerships differently to how we do today. The second is for us to be much more nuanced about the different contexts that we work in. And we're going to take that even further beyond the graphic equalizer that I just showed you. And the third is that we need to think about the required capacities differently if we're going to tackle that question of why hasn't this moved forward as we wish it would. So next slide, please. The first issue is about these strategic partnerships. And what we want to argue is that we need to go beyond the fairly regular and persistent focus on linkages being about the Ministry of Social Protection. It's not usually called that, but it might be so. It might be the Ministry of Labour and Social Affairs and so on, but it's the ministry that's responsible for most social protection and for coordinating anything else that happens elsewhere. Now, in the interviews that we held with people, a lot of respondents said, we only take one route. We're only going to the Ministry of Social Protection and not anywhere else. And some of the people that we talked to who had been involved in the seminal OPM and ODI work on shock responsive social protection said that they often wondered what would have happened if they'd started by looking at cash transfers through a Ministry of Disaster Risk Management. Might we be travelling along a really different pathway to the one that we find ourselves on today? So one of the ways that we might want to move from 101 to 201 will be thinking more broadly than that. Next slide, please. So here's an example of why we might want to move beyond this. One question that we need to ask when we're thinking about where we're going to route through is how many shock affected households we might expect to reach if we route a shock response through existing social protection programs. Now, this specific example is from Nepal. It uses survey data from the 7 most seriously affected districts following the 2015 earthquakes. And what it shows us is if we did a vertical expansion of social protection, so if we gave additional funding to people in the existing social protection programs in Nepal, what's called the SSA, the Social Security Allowances, we'd reach 56% of people who reported as being earthquake affected. That means conversely that we'd have 44% of people who had been affected by the earthquake, but that we wouldn't be able to reach through social protection. And it shows us that routing shock response through social protection can certainly be an important part of any humanitarian response. And in this case, a really important part of a humanitarian response, but it can't be a substitute for it. It can't be the only thing that we do. Next slide, please. So the example from Nepal reminds us that we need to not only work with the ministry responsible for social protection, we need to not only work through social protection programs, but we also have to work with other government agencies to ensure that we have a comprehensive and an adequate response and that we don't have big exclusion errors in what we're doing. So for us, that means instead of having multiple humanitarian agencies all queuing up at the door of the ministry that's responsible for social protection, there are other partnerships that are important, and some of them are highlighted in this slide. So on to the next slide, please. The second thing that we want to do is try and think beyond the usual countries. And that's particularly because if we continue to focus on the same places, we might find that elsewhere there's rather little left for us to link to. So here's data that I downloaded yesterday from the ILO dashboard. Oh no, on Monday from the ILO dashboard, and it shows us coverage of social assistance over the last few years across the world. Now, when we do work on linkages, we tend to cite lots of countries again and again: Philippines, Ethiopia, Pakistan, countries in the Caribbean. For those of us who work on social protection, we love the Mexican examples. But what we still don't know enough about, and what we pay far less attention to, is how we might do this elsewhere. So we have far less experience, not no experience, but far less experience in the countries in the red zone in this diagram. Places where we potentially need to be doing an awful lot more, but are less clear on how to do it. Next slide, please. So this takes us to some ideas about how we might move beyond those usual suspects, those examples that we always use. And in doing that, we've built on the typology of context developed by FAO and added another layer to that context. And what we found is if we try and think more about context, rather than thinking about where did we get the best example of a registry? What do we know about targeting? What do we know about setting up a risk financing mechanism? If we think about different contexts instead of doing that, we start to find ourselves with a lot more examples of good or useful practices. And it allows us to focus a bit more on comparisons between different contexts, what works where and what the obstacles are. So we are able, for example, to contrast what's feasible in type 4 with type 5. So we can contrast what we can do in Turkey, a highly shock responsive national social protection system, where shock assistance is managed through a centralized database and process. And there's an awful lot of opportunity to respond, to scale, to flex. We can contrast that with situation number 4, a more limited shock responsive national social protection. For example, Kenya, where the capacity to flex in response to shocks is not numerous across programs. Some programs do it well, others far less well. And where those harmonization processes are underway, but the centralization of systems and databases is still fledgling. We can also, using this approach, contrast what we can do in a situation where the social protection is severely weakened. So for example, type 1. And here we might talk about Yemen, where delivery of social protection or linkages is progressed through parastatals and where partnerships with NGOs are critical. And we can contrast that to places where there is a government system, but it lacks resources, not willingness to respond to repeated crisis, such as Malawi, our example under type 3. So we found that the other thing was that if we added a further contextual layer to the FAO typology, the additional row at the bottom, that of forced displacement, we were able to also try and look at what happens when you compound risks. So it may not just be a natural disaster or a man-made disaster or an economic crisis that we're seeking to respond to, but another layer of shock in addition. And we'll come back to those issues of compounding risks later when Daniel talks. So overall, when we have a typology of countries rather than a thematic organization of our analysis, we tend to find a bit more diversity in our examples, and we tend to be able to start to learn more and move forward. That focus on the complexities of context also helps us to move towards the final key message that we have. Next slide, please. And it helps us think about what it is and isn't possible to do. So this final message is about moving beyond technical fixes and training. The logic is that if we start to broaden those lenses, if we start to think beyond only one kind of institution that we're linking with, if we start to think beyond the usual countries that we talk about, and we start to use alternative lenses or approaches or ways of thinking about this, we think about it differently in different places. That has implications for how we learn and how we build our knowledge. And so I guess the key quote for us here is the idea of focusing on equipping people with the right soft skills to navigate dilemmas and make informed, often strategic judgments to develop context-specific approaches to social protection in crises. Next slide, please. So the way we've approached this so far, Generally, what we see around the world when we're trying to strengthen capacity is that we do two things. We build technical capacity, so those skills associated with getting targeting right, figuring out payment modalities, looking at how you establish a registry. And we do that using our hard skills, so things that are tangible and measurable, things that require very explicit and knowledge with a set of parameters, things where we have clear methods and structures and procedures and so on. And what happens when we focus on technical capacity and hard skills is that we immediately start to say, training, training, training. But there are lots of things that we need to do to progress further with linkages that are not amenable to these sorts of technical solutions. So things that Paul and I have highlighted already around tension between humanitarian principles and the ways in which people working on social protection engage with the state. This idea about different realities of the state, something that we do or don't want to engage with, something that we might work with in very different ways between humanitarian and social protection actors. And then also the politics of how we expand something in refugee contexts. And our argument is that we then need to change what we do to respond to some of these non-technical and challenges that need non-technical solutions. Next slide, please. And for us, this is a shift that is away from technical capacity and hard skills and more towards functional capacities and soft skills. So leadership, coordination, engaging with other stakeholders are not dependent on our encyclopedia of social protection to do. They're dependent on a different set of tangible capacities. But we also need a set of soft skills. A capacity to think through some of the political economy dynamics, a capacity to understand the ways in which governments function and work within some of the values and norms associated with that, a capacity to be flexible and not be too dogmatic about the way that we approach things. And in practice, that means a bunch of things like seconding staff so that they exchange and share different experiences, on-the-job training, coaching, mentoring, and peer-to-peer learning approaches. Next slide, please. So, in summary of what I've said so far before I hand over to Daniel, there's three key messages emerging from this. First of all, that we need to move beyond ministries of social protection and start to try and find new and different kinds of institutional partnerships that allow us to really maximize the ways that we generate linkages through our engagement with governments and others. The second, that we need to move beyond the usual countries that we focus on and capture those dimensions that we see in the unbundling work. And then third, that we've got to get beyond the technical capacity and the hard skills, which to be honest are the easy bits, and move to some of the harder elements such as functional capacity and soft skills. So with that, next slide please, and I will hand us over to Daniel. Thank you.
Thank you, Rachel. Before Paul closes, we wanted to draw on some reflections as they relate to COVID-19 and some of the connections with the report that we produced. I'll principally refer to the experiences noted at the outset by Julie that I've been having as part of a team of experts at the global level called SPACE. It's a team that is supported by DFID and German Development Corporation to give advice and analysis to countries to respond to COVID through social protection, humanitarian assistance, or the link between the two. Also, of course, I'll be drawing on lots of the excellent weekly material that's come out from the World Bank, ILO and UNICEF and the Grand Bargain Sub-Working Group in their weekly updates, so many thanks to them. My two slides here are covering, first of all, what we've been observing in these first few weeks and months, and the second on some of the things we've been learning and drawing from this process. All of this with a relevance to cash and voucher assistance, but also the wider context and systems and political economy in which they sit. So first of all, on the shock typology, there's no precedent in the shock responsive literature that, at least that I'm aware of, for an epidemiological shock. So most of the evidence that we have focuses on natural hazards, with conflicts as an emerging theme. So this is new ground for the concept of shock responsive social protection, and it means that some of the challenges and opportunities being faced are rather unique, but others are common and transferable. I think it's also fair to say that there's a lack of clarity on the problem and the potential solutions. So beyond supporting the health sector and healthcare systems, and generally knowing the need to support people and their livelihoods, in many developing countries, we're not sure on the primary and especially the secondary impacts of COVID. So what is the urban-rural dynamic? What will one morph into the other? How will lockdowns affect market functionality and food and nutrition security? What impacts will COVID-19 and the response have on gender and intra-household dynamics, amongst many others? Likewise, Kalp and others have pointed out that governments and people in many of these contexts face impossible choices when responding to COVID. So vulnerable people can't afford to stay at home, but risk infection if they go out. Governments do not have the capacity to enforce social distancing or provide large stimulus packages. These factors all have a bearing on programming decisions, of course, how we should respond, through whom, when, and using what modality. And equally, we're not seeing a large mobilization of new resources, so these decisions are particularly difficult. That being said, there has been a huge social assistance response to the COVID crisis, as you know well. So I was looking, and as of today, 181 countries have employed 870 social protection measures, of which 60% are social assistance, either in kind or cash. And in my understanding, the split's about 50-50, and that's covering 1.7 billion individuals, which is significant. So in a sense, we're witnessing a global study in shock responsive social protection play out. But there are lots of grey areas at country level, and especially in poor and fragile and conflict affected states, where it's not possible to use a social protection system, either because it's nascent, disrupted, or suffers from weak coverage. So here different solutions are required, and these under COVID are evolving under the sort of less well-defined linkage between humanitarian assistance and social protection. These include moderately or modestly scaling a social protection program if it exists, but often in combination with a utilization of components between humanitarian and social protection interventions, such as using a social registry list or a common financial service provider, or aligning specific elements of a program, such as transfer values. And there's also a big emphasis on coordinated programming, so that either you provide parallel interventions to the same household to improve adequacy, or you coordinate and make sure that you're achieving the greatest geographic coverage overall. So these various options around these are beginning to come out. I think in terms of the key operational issues being raised with direct relevance to cash and voucher, they're quite similar in many regards to some of the ones that we've been raising in the report. So I mean, to pick a few, the political economy issues are very prevalent. If you're a government, for instance, or a donor, do you use the little money that you have available and put it already into a social protection program, or target new people at higher cost? Do you support categorical approaches that are quick and more remote, but risk large inclusion errors? There's a lot of discussion around defining vulnerability and eligibility. The desire to act fast and minimize contact with individuals and with service and for service providers points to using existing programs, but these don't often align with who is most vulnerable to COVID-19. Of course, a lot of programs also are more focused on rural areas, and this has, at least at the start, been more of an urban problem, although I have a feeling that COVID may change the focus from rural to urban programs for good. We've also seen a lot of discussion about how you align transfer values and modalities. Do you use a minimum wage as your guiding indicator, or a minimum expenditure basket. There's a lot of focus on cash first, which is very encouraging. But there's always the question about whether there's the capacity to deliver at scale or to switch modalities if you need to. And last of all, data protection has been a huge concern. This is something that we've also been raising, that you how do you register the most vulnerable securely and remotely? And can you share that information in the future if you haven't obtained proper informed consent? Next slide, please. So what are we learning and discussing in this agenda, and what are some of the key messages that the space team and other practitioners are beginning to provide? So first of all, there's a key message, of course, around timeliness and simplicity, that we need to act fast to protect livelihoods and reduce negative coping. But for this, there will be trade-offs needed. So for instance, actors can sequence different interventions, moving from simple to more complex. For instance, social protection programs can relax conditionality for a certain defined period of time to align with a humanitarian approach and reintroduce it later, and then move towards complementary programming between humanitarian and social protection sources. Another example would be in terms of targeting and targeting accuracy, to relax targeting criteria or know your customer requirements, and accept perhaps a higher degree of inclusion error at the beginning, but then boost monitoring and grievance referral mechanisms to address those errors later. The second thing is about building on what you have. So this principal focus, retaining a focus on trying to improve the adequacy, comprehensiveness and coverage of social protection programs and systems wherever possible. Asking that question first before considering parallel or new programs, and if designing parallel or new programs, considering how to link to solid components for pre-existing social protection or humanitarian program, such as on data or a financial service provider or a targeting tool. The third message is about coordinating to ensure coverage and horizontal equity. So on the one hand, this means avoiding duplication by coordinating to ensure geographic coverage, to ensure everyone to the degree possible is covered, but also, wherever possible, ensuring horizontal equity, which means the people in need shouldn't be receiving vastly different levels of support from different actors, if not for objective and commonly agreed reasons. There's a lot that social protection and humanitarian actors can learn from each other, and not all of it, I think, is immediately obvious to the other side. What we know is that coordination is easy to talk about and very hard to execute. And that often this talk of linkages and nexus boils down to finding one or two things that can be done differently together. The fourth message is around recognizing that shocks are often cyclical and compounding, so that we know that shocks of any kind have a habit of returning, repeating, and intensifying the effects of other shocks. We know that households are often managing the effects of multiple shocks simultaneously. This is very probably true in one sense or another for COVID and how COVID plays out. Therefore, point 5, we need to act short term but think long term. So the tools and the systems and the processes we're putting in place now can help build a better shock responsive system for the future. And they're not confined to this specific shock. So it will be essential to learn and think about how measures can have wider ramifications. Don't waste a crisis, as the saying goes, but don't be opportunistic either. And that brings me to my last point about avoiding tunnel vision and focusing on common purpose. So this very much reflects some of the ongoing debates that colleagues in countries are having. First, we need to be realistic. Not every situation is suitable for a shock responsive approach or linkage between humanitarian and social protection, and neither should it be. And practitioners need to make joint assessments on a case-by-case basis. And this is one of the things that we talk about in terms of needing more hybrid profiles from practitioners so that they're able to look both ways and understand both sides of the argument. This was coming up repeatedly in the key informant interviews. Secondly, we need to use this thinking around shock responsive social protection and linkages to enhance our common purpose, which is to improve assistance for those most in need, which we agree in many cases is deeply problematic. So focusing on our common purpose should include knowing when to run things in parallel, knowing when to use certain parts of a system or using one or other system entirely, but having a joint understanding of why we've come to that decision as part of a coherent strategy. So I think if the global work on COVID can help with this long and ongoing discussion in some way, it would have clear value. Thanks very much. I'll pass over now to Paul to wrap things up.
Thank you, Daniel. So I'll just talk for a couple of minutes and then we'll get cracking on with the discussion. So, our real argument as we started with was getting beyond 101. We heard from Rachel about how it's sort of not just about training, not just about the technical, but about thinking about soft skills. I think I'd add to that a need to get beyond the usual suspects. Certainly in the humanitarian cash world, we've got a great tendency to talk to each other and agree with each other and not get beyond a fairly cozy circle of people who agree with each other. And the real dilemmas that we've been hearing about that need to be debated, not sort of whisked away, mean that you have to talk to people who disagree with you. And in that spirit, and to kick off the debate, I'm just going to talk about a couple of things that we've been debating in our group and we want to continue debating. First point is more important than I've been hearing. It's a key moment. There's a huge expansion of social assistance with COVID-19 response, a huge need more than ever to link humanitarian cash and social assistance when it makes sense, and potentially sort of new windows opening up with that expansion in terms of thinking in different ways about things like basic income and targeting that need to be sort of seized. Second point is that the COVID response is arguably showing the centrality of the state and the need for scale. And in thinking about that, I remember a meeting at CALP a number of years ago, maybe 10 years ago, where we were debating large-scale cash. And we had started by having a debate, what does large scale mean? And I put a pitch in for sort of, at least 100,000 households. And the NGOs around the room all looked a bit nervous and said, well, no, I think maybe 10,000 is more appropriate. And then MasterCard stood up and started talking about the several million transactions they do every day. And we were also hearing about the sort of Pakistan government earthquake response, which was reaching several million people. And so our argument is that COVID shows the centrality of the state, the need for large-scale responses, and humanitarians are largely irrelevant in that case, and they should just get out of the way. Or, as a humanitarian, probably I need to look more carefully about where international humanitarian action is really needed and where it can really add value and how. And then the point about when it's sensible not to link. I mean, it came when we were doing the research. There were floods in the UK going on, and we made the point that the UK government response to floods doesn't involve an expansion of child benefits or a payment of additional pensions to people. It involves a separate disaster risk management system that kicks in. And there are floods now in Kenya and Somalia where you might not want to link social assistance. You might want to be linking with a national disaster management agency and thinking about how there can be emergency responses to temporary shocks. So I think that a debate about when you should not link as well as when you should link can be had. And then finally, and to lead in debate, there's been a tendency over the years, in particular this debate, for endless sort of slightly circular discussions about how you might link and why you might link and how it's hard to link. A tendency to wait for the right tool. And an argument I've been making ever since we started doing humanitarian cash of a need to just sort of get on and do it and learn from it. Arguably, COVID's forcing governments to do that. We're seeing quite a lot of just doing it, which means there's huge scope for learning in that, but also, I guess, huge scope for things to go badly wrong and to agilely tackle Julie to moderate discussion. I see on the chat that some questions have come in, and we can start trying to respond to those and open it up more broadly. Thank you very much for your time, and great to get into the discussion.
Thank you, Paul, and thank you, panelists, for such an interesting overview and for showing us some new directions. We've had quite a few questions coming in. Could I just ask that anybody who asks a question, please state your name and who you work for, and if your question is directed at a particular panelist. So I think the one particularly interesting question is about what opportunities are coming up with COVID-19 to shift the relationship between humanitarians and social protection systems in countries with partially developed social protection systems over the short to the medium term. So what role do you see for both in the short term, and then if we see recurrent shocks in the medium term, how would you like to see things playing out? And I'm thinking about maybe a fairly low income country with some social protection systems in place. What advice would you be giving right now? And this is to all the panelists.
Shall I have a go? I mean, I guess the thing for me, I come at this from the social protection side, and for me, it's if humanitarian agencies are going to link with social protection in order to deliver relatively short-term cash transfers in response to a particular shock or crisis, that they have to do so in ways that leave something behind for social protection itself. Now, that might mean taking things that humanitarian agencies are really, really good at, for example, MIS systems, building beneficiary databases and so on, and ensuring that elements of those are maintained. So it might be that you're establishing a monitoring process which is fit for purpose in regular times, not just in a humanitarian crisis, and that then that lives on following the exit of humanitarian actors. Thank you.
I think there's, just building on that, there's definitely some good examples coming out of, for instance, the use of a social registry list that's been created by a social protection ministry. It may not be, you know, wholly, it may not be entirely comprehensive of a population or a geographic area. But there are other tools that you can use, even if that's not the case. For instance, the data collection tool, the questionnaire. So you don't even have to answer all the questions on that questionnaire, but you have to do something in a uniform way. So just building on this thing about, you know, building up data, building up MISs, and having a common approach to who you target and why. I think we're seeing quite a lot of interesting discussions around how you align transfer values, and you're seeing a lot of humanitarian influence coming in that process, and that's not contained to any type of country. That's going on everywhere, including in low capacity countries. I think what you're seeing perhaps less of, and we could see more of, is some of that humanitarian influence. So how do you monitor markets so that you know indeed where the pressure points are in the household economy? How do you monitor markets and indeed livelihoods in general to understand if what you're giving is sufficient? How do you ensure a certain amount of additional accountability in a time where everyone's trying to do things quickly and remotely to ensure you're actually reaching the right people? And are those people changing over time? So I think it's hard to speak about one country because a lot of them are in the context of finalizing plans, but these are definitely some of the things that are coming out repeatedly, which shows that people are trying.
Paul, do you want to come in on this one?
I didn't. I could come in on some of the ones that have come in on the chat. That would be helpful.
Okay, so thank you. I'm going to go to a question that Catherine Tate from WVI asked early on, because I didn't quite understand it, so apologies for my slight slip up there. I need to go to webinar. She's asking, what about accountability mechanisms? In the humanitarian system, we have strong accountability mechanisms. Does your research, does your learning show us how we can ensure that when you're linking with government or coordinating with government, which maybe doesn't have such strong mechanisms, how you can go about this? I hope I've got the question right now. Paul, would you like to take that one?
Yeah, sure. Strong accountability mechanisms, I think, is probably on the optimistic side of humanitarian accountability. I think the issue is that as humanitarian accountability mechanisms and cash accountability mechanisms have got a bit better, even if they're not great, they've remained somewhat agency focused and somewhat cash focused. So I'd argue two things. So first is they could helpfully more often be more system wide, not looking at just people getting cash, but at people not getting cash and the needs of the population, whether or not they're being met. And once you've got them more system wide in a humanitarian sense, they need to be better linked to government and other mechanisms of accountability. Because at the moment, governments are enabling, humanitarian agencies are enabling people to complain, but it's a sort of one-way relationship between the agency and the person complaining, rather than linked into other forms of accountability into government. And that links to the other question someone raised on the chat about the need for responses to be more citizen-centric and arguably linked to national development plans. Again, I think you're being slightly optimistic to assume that national development plans are citizen-centric, but yes, humanitarian cash and humanitarian cash linked to social protection definitely needs to be more citizen-centric. And I think the way of doing that is what I've just been talking about, is to try and link humanitarian accountability mechanisms better to national citizen accountability mechanisms at local and national and regional levels. And then there was, to link it up with another question in the chat, was about cash working groups. And yes, I'm sure cash working groups are doing all sorts of brilliant work in trying to coordinate and collaborate around linkages between humanitarian cash and social protection. An issue in them being able to do that is the fact that they still sit somewhat uneasily in the system. And something that donors could helpfully do is push agencies to make their minds up about where cash sits within the formal humanitarian coordination system.
Just can I add one thing there, Julie? Just as Paul raised it, I think the coordination challenge is paramount, and in all the literature this comes up as like the keystone principle for improving shock responsive and other approaches, but also the #1 challenge. We know this challenge well. Not only do cash transfer working groups, there are some very good examples of cash transfer working groups who are trying to, in their mandates, have a link to social protection forums, but that's still a kind of fledgling area. As Paul rightly said, they also sit a bit out of the system. On the other hand, on the social protection side, there's no, again, unless I'm making a huge error here, there's no global social protection cluster for crises. So there's a protection cluster, which of course is not the same thing. So now that social protection actors are moving into this kind of shock response space, there are, I think, some big questions about who do humanitarians link to exactly. Is it a regular SP forum or a donor forum? And is that type of forum fit for purpose in emergencies? The timescales are different, the information requirements are different, and the expertise is different.
Rachel.
Thank you. I've got a couple of things to say around accountability, around coordination, around engagement. I guess the first thing is that as somebody coming from the social protection side, one of the things that I feel slightly suspicious of is the extent to which, in a very challenging situation for humanitarian agencies and international actors in general, in getting some sort of accountability when it engages with national disaster management processes, that social protection becomes an easy route to accountability. So in one of the countries that I've worked in recently, that I've referenced earlier, there's been a huge push around routing humanitarian response through existing social protection that, for me, is not really about that being the best thing to do, but it's about the fact that there's no accountability for humanitarian funds that are routed through government. They often go through Prime Minister's relief funds and things like that, and there's no mechanism by which we can show that you can prove to the outside world where something was spent, how it was spent. There's zero accountability. And it seems to me that in countries like that, it's very, very alluring to be able to route your response through social protection, because there are the monitoring of who received what, when and why, particularly through systems where we've got really great MIS, is much, much higher. And I guess what I don't want to see is us just jumping on that system as an easy form of accountability when it might not actually be the best response. The second thing is partly in response to Catherine's question about how do we avoid a patchwork, or how do we avoid inconsistencies and so on. I mean, I think patchworks are okay as long as they don't have huge holes in them. And one of the problems that we have when we try and be nationally uniform, or have a set of shared national principles or a set of shared protocols, and indeed in Simon's response, if we have an internationally coordinated set of principles, values, procedures and so on, is that we fail to adapt to what is needed locally. And, you know, Ari has responded and said, you know, what about citizen-centric decision-making and protocols and systems? Somebody else has responded and said, you know, the capacity issue is not at national level, and it's not in international agencies, it's at a subnational level. And I think that until we start to recognise that there are different levels of accountability, different levels of engagement, different levels at which coordination is required, we won't get very far. We'll just end up with a single monolithic model. So recognising that quite often we're trying to respond to a shock in a distinct geographical location, a district, sometimes a state or a region, and try and get away from trying to produce the brilliant, all-encompassing, overarching framework for accountability or coordination or anything else, and try and focus more on how you have a set of principles that you can filter down and adapt to the geographical or territorial level at which you're operating, is probably, I think, a better way of trying to move forward rather than trying to do something really high level.
Great. So I'm going to pick up the question on gender next, because it's always close to my heart. So there is actually a section in the report about, you know, the importance of thinking about gender. But can you draw on your experience and the work you did for this report to think about how to, you know, gender analysis and understanding gender outcomes in this linkages area? And it mentions COVID in general, so let's stick with the sort of general, because it might be a bit soon for COVID, although we've got a lot of signposts about how that is having a gender differentiated impact. Rachel, yeah, I thought you might want to take this one.
I think one of the key things for me that becomes particularly acute when we start to think about linkages rather than thinking just about social protection is trying to take an approach which is about intersectionality. So there's a great piece of work about Kenya about the fact that refugees who are women are simply refugees, and they're identified as having zero agency whatsoever and zero other social identity attributes. Their religion goes out the window, their ethnicity goes out the window, whether they suffer from a disability or not goes out the window, because we only focus on gender and we don't think carefully enough about how those different social identities intersect, and it's only by doing so that we're going to be really sure that our programming is gender and intersectionality sensitive. And Julie, I actually think that applies quite a lot in COVID. And I mean, this is Rhodes and Flo who's asked a question about this as well. I think if I have a reflection on how we're programming for COVID at the moment, it's that it feels like we're on one track and we think there's one problem. And it's generally a problem around people not being able to maintain their livelihood. But if you look at what the obstacles to people maintaining a livelihood are, and particularly obstacles to women in situations where they might be doing all sorts of different kinds of care work on different terms, there's a real difference in what your social protection response is if you are trying to particularly protect people who are shielding or self-isolating. In this country, it's predominantly people over the age of 70 who are being asked to shield. So one thing you might do there is top up a social pension. Whereas if predominantly your social distancing measures are things like they're preventing people from going to work on public transport, then the group that you're trying to support will be a different one. And I think the thing that I'm learning at the moment about COVID responses in developing countries is that differentiation just isn't there. We're not thinking about mortality effects versus morbidity effects or illness effects. We're not thinking about shielding effects versus social distancing effects and so on. And I think the more that we can do to diagnose the problem with a little bit more granularity, the easier it will be for us to see where linkages are appropriate and where they're not. Because, for example, I don't see the role of humanitarian actors if a priority is scaling up the social pension. I can see it if we're talking about trying to scale up to protect people who are being forced to social distance and can't take public transport to work and so on.
Julie, I'm not going to attempt to add to that, except to say that as part of the space team, there's a series of analytical pieces that have been put together. So on the question of gender inclusion and COVID, there's going to be a piece coming out soon, I think. So it would be interesting to look out for that.
Thank you. Paul, any thoughts? And I wonder if we ought to maybe sort of go beyond gender to thinking about old age, disability. I mean, Rachel's mentioned those when thinking about comorbidities, but how can we bring intersectionality in without overloading, without making a rapid response a slow and too complex response?
On gender, so there's, I mean, I was trying to think about anything to add. There's obviously, there's been actually quite a lot of work recently on the humanitarian side of things around gender and humanitarian caste. It's something led by Cal, and lots of great work by the Women's Refugee Commission. In a linking sense, I wonder if some of the work on gender and humanitarian caste is sufficiently linked with the work on sort of gender and social assistance, and whether there might be scope for some sort of cross-learning between the the bodies of people and work on that issue. And clearly, yeah, there's sensitivity in all sorts of dimensions, whether it's around disability or age or conflict or many other things, is a challenge always, and it's particularly a challenge with cash when you're often you're trying to mainstream cash across the modality across multiple responses, and whilst mainstreaming cash you're trying to mainstream all the other things you need to be sensitive about, and you're an overloaded program manager somewhere whilst being locked down is hard. And so overload is definitely an issue. One of the areas I think where there's need for a lot more work, certainly in the humanitarian caste sphere, is around disability. It feels like in the last 2 years, the problematic gap around gender humanitarian caste has started to be tackled, at least in terms of sort of learning and resources. I'm not sure the same can be said of disability and humanitarian caste. So if there was a place, I think there's a need for a particular focus, it would be there.
Great, thank you. And another sort of theme around the questions coming out is what should be our advocacy messages around COVID-19 and cash and social protection? What are the sort of quick one-liners, the the appeals? What's at the heart of these that you've learned from your work? I think maybe Daniel touched on some of them, but you know, what are your advocacy messages during this particular very unusual crisis? I mean, I really liked Stefan Durkin's paper on no regrets, you know, and the sort of, I think it was 9 things you could do that, you know, you would not regret doing later. So if you were, you know, where would you sort of position yourself, something like that?
Who are these advocacy messages for, Julie?
Well, we've got a diverse audience. There have been quite a few questions asking who should be in the lead, what the role is of INGOs or government or NGOs, national NGOs, civil protection. So, but think about UN maybe, think about the fundraisers, think about INGOs, think about national NGOs, you know, yeah.
Okay, I mean, I guess I've got 2. I guess one of them is linked to the point that I just made about identifying who needs what kind of support, that blanket responses are not going to help here, and that we're going to have to be dynamic over time as things like social distancing rules or shielding rules start to change in different countries at different rates. The second one sort of responds to a question asked by Ari about how you avoid delivering on COVID at the expense of the other programming that you're doing. And for me, it's make sure no one falls between the cracks, particularly people who were receiving some kind of support now and are not. So a great example of that is how you ensure that we're protecting vulnerable children who were receiving meals at school or take-home rations or education stipends and so on, who are at risk of falling out of our beneficiary lists at this moment in time. So make sure no one falls between the cracks.
Great.
I mean, perhaps just to repeat 1 or 2 messages from what I presented, but I think overall it's very encouraging to see so much emphasis on cash. So that's a positive that you're seeing in terms of the response. But there's a need, I think, to proceed with a note of caution. So when we talk about people falling through the gaps, we're also talking about, you know, the mobile money can seem like an excellent way of getting to people, especially when you can't physically get to them. But depending on the know your customer requirements, depending on cashing out requirements, many factors, it's obviously not a panacea. You're sending to a SIM, you're not sending to a person. So I think that there's just also more thinking around how you ensure that you're reaching the right people when you're thinking cash first, which is the right principle to take, and who can team up with who, and it doesn't just have to be the responsibility of one actor. It can be also part of a localization agenda and getting more people involved to ensure that accountability, that the right cash is reaching the right people.
Anyone else want to come in on this one?
I guess 2 quick points. I'm conscious also that we should give the floor moderately soon to Rachel Sabattis-Wheeler, because it'd be great to get her thoughts. I guess 2 points. One is, if I was thinking what, you know, the advocacy point towards humanitarian agencies, I guess would be a sort of probably a need for sort of modesty about your role at this stage. I mean, whilst I don't think you should get completely out of the way, I do think that it is a moment in which, you know, governments can and should be and are taking the lead, and so thinking carefully about where, as international aid agencies, you can add value, I think is necessary. And I guess the second point is around the sort of the argument we're making that this is hard because it presents sort of dilemmas and problems that not everyone's going to agree about. And so I guess a message about sort of maintaining space for disagreement. So in trying to bring people together in whether it's coordination structures or elsewhere, not sort of steamrolling disagreement, you know, enabling people to have, you know, critical voices. And for international actors, I think particularly to to see one of their roles as being able to sort of constructively criticize some of the emerging responses and trying to find space to do that, which will be hard within, you know, restrictions and authoritarian regimes, but thinking about ways in which you might be able to maintain that space will be important.
Great, thank you. So, good reminder, Rachel Sabatas-Wheeler, would you be willing to sort of step in and give us some thoughts about where the conversation's been going and what you feel the sort of key learning should be?
Hi there, can you hear me? Okay, good. I've been listening in. I've had a couple of issues with sound, but I have heard most of it, and it's been a really fantastic presentation. And thank you everyone for those great comments. I guess I'm just coming in, and I'm not going to wrap it up in any way, shape or form, but I'm coming in just with a few comments. A couple of things sort of piqued my interest. One was particularly around the accountability issue, social accountability in particular. I guess the question that was raised assumed that accountability was pretty good on the humanitarian side. I come with a social protection hat on, and it's rubbish on the social protection side. So in terms of learning, there's not much that will come from social protection. Social protection is relatively new to the social accountability space. Education and health have been very good at thinking about social accountability, whether it's sort of top down, bottom up, how you do it, how you actually allow active citizenship, people to actively engage with these programs, with their rights, with their entitlement, not us saying, oh, here you are, we'll give you a handout and we'll set up a place for you to come and complain. But actually, how do you engage the people you're trying to serve so that they themselves are able to actively claim what is entitled to them? So that needs a lot more work, for sure. And it'd be great if we can see some more work around that, particularly in regard to shock response and linkages. The other thing I wanted to raise, and I raised in the chat box, well, that hasn't come up much, but we added as a kind of sixth context of social protection, was this forced displacement, forced migration, anything around mobility that leads people, refugees in particular, to be in a space that's relatively undefined in relation to a state. So undefined in relation to their rights, in relation to citizenship, in claims. Who are they going to be making claims on? So there's a real issue, massive issue here, given the amount of mobility and migration and forced displacement that's going on. And how do we think about this linkage, this nexus in that context, in terms of the tensions between the principles? So social protection is fundamentally set up within a nation state, and we want the governments to own it. And therefore, it pretty much defines in terms of we are here for our citizens. Whereas humanitarian principles, you know, around impartiality, they should be provided for everyone, whoever's in need at any point. So how do we bring those two issues together, and should they be brought together? So there's a real issue that we questioned. Rachel raised it, I think, and Paul raised it early on, about we don't always have to link these two things. There might be cases where we have to think very strategically, politically about when and how we need to link different aspects and provision of humanitarian and social protection, depending on who we're trying to serve and what the needs are. And when you think about the political tensions for certain groups of refugees, we wouldn't necessarily want the governments to be defining who gets what. And social protection is typically framed in the countries I work in around the deserving and the undeserving poor. You know, or they're deserving, we'll give, they deserve social protection, but that would pretty much fly in the face of a humanitarian principle in terms of putting those categories, which are very value laden, on which target group gets what. So I think we need to think really carefully about that going forward. There's no doubt there's a lot to be learnt across the different sectors, across the different spaces, training, capacity building, skills development, but also to be really aware of the political spaces we're working in, and what Rachel was saying, this intersectionality of needs, and how that creates very different requirements for responses. So they're just a couple of comments. Otherwise, no, it's a good discussion. Let's carry on for a bit more.
Great, so we've only got a few more minutes now. I'm going to turn to some fairly practical questions that have come in. There's a theme emerging about how to expand registration. Can you give us some good examples of how registration of those in need because of COVID-19 have been quickly brought onto some sort of register or another? And Daniel, I think we're asking you to draw on your experience here, but any other ideas or instances that you've come across in how those in need have quickly been drawn in to lists?
Paul, did you want to go first there?
No, I wanted you to go first, and then I had my hand up.
Okay. Well, yeah, I mean, obviously this is dependent on a great variety of factors. So I'm just going to, and where the country's at in terms of different things, including data management and registries and so forth. But just to throw a few examples out there, we're seeing quite a lot of countries who are advancing forecasted beneficiaries, meaning they have a rollout plan for 2021, 2022. They're bringing that forward. So they're acknowledging that that is going to spread a wide net, but at least within that they can catch some of the fallout of COVID and also accelerate their expansion plans. I think some other things in terms of targeting, I mentioned one in and the quick expansion to meet additional people is taking an existing list from a social registry, and then whichever program wants to use it, they then have to do some second level verification, and sometimes it's still quite onerous and personal, i.e. door to door, to double check because the accuracy and up-to-dateness of those lists is sometimes questionable. But people nevertheless are trying it, and they are finding that in terms of time saving and cost saving, there are still significant benefits to starting from a traditional list, a pre-identified list, even if it's old. And then a last thing I think that we've seen in some cases in terms of quick expansion is interesting mixtures of categorical, then followed by community-based. So again, you can take census data, you can take population data of urban areas, and within that you can start to screen out areas that are known to be particularly poor, particularly dense, or particularly informal in terms of labor patterns. But then that is often insufficient in and of itself, and you're then taking that to council leaders or door-to-door verification or another means of cross-checking, and then within those areas, what are sometimes called hotspots, you can then do universal targeting. So you then accept that within those pockets of those districts or whatever administrative side you have, you will do universal targeting, and there will be more inclusion error than normal, but it enables you to move, and it enables you to move remotely.
Paul.
Yeah, so we've had a bunch of questions on, as you say, on registrations and targeting. And so clearly one of the way forwards, ideally, is to do what Daniel was saying, was to keep it simple, to make it generous and not worry too much about inclusion. And some governments are able to do that, but not all. So I was just hearing that for refugees in Uganda, they've just had their food assistance cut by 30% because of funding shortfalls in Uganda. So, it's about the worst time you can imagine for cuts in entitlements, not expansions in them, but that's going to be the reality in some contexts. And maybe particularly the reality when it's not governments that can print money and worry about inflation later, but aid agencies that are responsible, are operating on declining budgets. So I think we need to be particularly careful where that's happening and think about what we can do about it. And then one of the comments, so picking up on Daniel's point about the sort of potential for sort of layering approaches. One of the comments was, I think, around, can we get beyond the usual suspects and use people like community health workers for targeting at a very local level? and clearly, you know, that's hard within really large scale systems. But if you can have sort of simple categorical straight universal approaches that then allow some sort of devolved responsibility for people to, you know, who are working at community level to enable people to apply to systems, I think might be one way of sort of squaring that circle. And where there might be very close links to sort of the case management and protection roles of workers in a humanitarian sense. So being able to identify particularly vulnerable people and enable them to get assistance by keeping application processes open. That was it. Rachel, did you want to come in?
Great. Well, we've only got about 2 minutes now. One issue that's come up a great deal is around in our discussions at CALP, and I'm going to grab this moment, is around liquidity. You know, the flow of remittances has fallen dramatically. We're not sure how much funding there will be to support a humanitarian and a development style response. What can we as cash actors do at a sort of macro level with this remittances flow, with liquidity within countries as well as within regions? Any thoughts here about some sort of easy wins, or where we should be putting our money or our voice?
I don't have much to say on this, but there are a set of examples, some of which have been highlighted in the World Bank UNICEF stuff led by Ugo Gentilini, of transaction costs and administrative costs for both accessing credit or for transferring money, when in the case of remittances, being either reduced to zero or subsidized to a very large extent by governments or indeed by private sector companies themselves. So that's not providing liquidity, but it is reducing the reduction in monies that are transferred or indeed monies that are loaned.
Anyone else? Daniel, has this come up in the space hub discussions at all, the issues of you know, really severe liquidity flows?
It has, but it's not something I've been following myself, so I feel a little bit you know, unqualified to comment.
Sorry, and that we just had a consultation recently with the cash working group, and it was, well, the set of cash working groups in MENA, and it was a big theme for them that they couldn't get access, and that, you know, money was not getting out to the remote areas. So we have 2 minutes left. I'm going to say thank you very much to everybody. This has been a fascinating discussion, and I'm going to ask Sarah to come in and close for us, please.
That was, yeah, no, and it was absolutely, it felt like such a treat for me to be able to sit in the back and be very disruptive, I think, with all the commenting. But yes, a massive thank you to Paul, Rachel, Daniel, and Julie for that excellent moderation and facilitation. I also want to give a round of applause to socialprotection.org and all the hard work that they are doing around this, and, you know, keeping us all on track with everything that's happening. They have a next webinar coming up as part of their COVID series. And I think Karine has put that link in over there as part of the Grand Bargain subgroup. Our next webinar is going to be on the 18th of June. We're in the planning stages for that. We do ask you to get in touch with us. It is an open, inclusive group, the Grand Bargain Cash subgroup on linking social protection and humanitarian cash transfers. We have social protection actors, we have humanitarian actors. Absolutely get in touch, because the products that we are coming up with are for all of you. Keep an eye out for the summary and the questions that we were unable to get to. And again, we had so many questions coming in, at least 30. We will be posting those on a blog, and I'm sure that blog will be cross-posted on CALP, but we'll see what happens. But it'll definitely be on socialprotection.org. There will be the recording that you will also receive, and with that, this might also be the first time we've actually ended on time. Thank you very much, everybody, and we will see you next time. Stay safe wherever you are. Take care.